I really want to thank my colleagues, Representative Ocasio-Cortez and Representative Bowman, for informing me about this great program. And when I was speaking with Alexandria on the phone, and she was telling me that she's trying to get some extra help, and she told me about the program, and she said a 52% less likely chance of being injured when you go through this program, and it's nationwide. I said, wow, how can I help? And she said, well, she's visiting with Jamaal. Why don't I come up? So here I am. And I'm very glad to be here. And I want to thank, how many of you work here at Jacobi? I want to thank all of you for the great work that you all do. Especially in the past year, I know how difficult it has been. So let me just say this. Youth violence is something, quite frankly, that we have to be focused on. When a youth is taken from us, it's so bad, of course, for the family, but for our whole society. And we have to do what we can about it. And what we're learning is there are certain things that we never knew about that actually work and can reduce the chances of youth being killed, maimed, injured in violence. And that's what they've been doing here at Jacobi. And that's why I am so interested in, stuck together. I'm so interested in all of this. SUV has a national model that does two critical things. First, they do a lot of one-on-one. They mentor at-risk youth on educational and job opportunities, and they deploy outreach workers to go to emergencies and work to prevent retaliation. These are amazing things. These are difficult things, but they're things that should be supported, and that is why we are here. They also assist family members of those who have been injured or killed, and we want to be proactive. That's what we're doing here. Don't let it happen and curse the darkness. Light a candle, do something good like all of the workers in Jacobi's program are doing. So this program works, but it needs some money. And so we now have, what do you guys call them in the House? Not earmarks anymore.
Congressional Funding Project.
We have something called Congressional Funding Project.
Community Project Funding.
Community Project Funding. And we can get some special money that now is designated. The theory is very simple, and that is that the representatives of the area know more about the needs of the area than someone sitting in Washington. And so this was one of the programs that the two representatives pointed out to me needs help. And so we in the Senate are trying to get the same kind of funding. Democrats are for it. McConnell's not. Shelby is. So I think we'll be able to get it. And I am here today saying I fully support the additional $400,000 in federal funds, which would mean a new emergency room social worker, a caseworker that stays with the person or family throughout the journey, psychiatrists to evaluate mental health needs, a therapist, and probably most importantly, people who can provide that peer-to-peer support and that mentorship that is so important. These are essential workers, every one of the people I've mentioned. We need every one of them. So that's why I am so excited to be here and support this program. We know that gun violence has become tragically commonplace. That's another thing we're going to try to do, is pass H.R. 8, which is universal background checks. I'm the original author of the Brady Law, the background check law, and it now has some holes in it, which we want to fill. The House again has passed it. We're going to work hard to get that done as well. So the other thing we have to do is support the family and friends of gun violence victims to help them heal, and that's another thing that this wonderful program does. So I am totally on board, fully committed to helping in the Senate with this program, and thank our representatives for turning me on to it. And thank Dr. Katz and all the workers in the program for what they do.
All right. Thank you so much, Senator Schumer, Majority Leader Schumer, and
Chuck.
Thank you, Chuck. We're so excited to be here today, and I think today represents a really momentous moment in how, I think today's a really momentous moment and a real tipping point in the start of this journey to make sure that we reframe how we treat and bring down violence in our communities. I want to put a little bit of shine on the people who are standing right behind us right now. These are the Stand Up to Violence organizers and outreach workers. What does the Stand Up to Violence program do? It is a really innovative and cutting-edge program. And I want to give Jacobi and our leadership at Jacobi and our doctors at Jacobi a ton of credit, because they started this in 2014, way ahead of the curve. And it's not a coincidence, I think, that Jacobi is a public hospital doing this work, focusing on our communities. And so what did Jacobi say in 2014? There were really innovative doctors and outreach workers, public health workers that said, listen, we have incidents of violent crime right here in the Bronx. Now, what would happen if we started looking at violence as a public health issue, and that we respond and make the nexus of treatment of violence the hospital? And so what they decided to do back in 2014 is start a journey that culminates in this program, where if someone gets admitted to the hospital with an injury that is highly correlated, usually with something like violent crime, a gunshot wound or a stabbing wound, for example, we bring in, yes, a doctor to make sure that we patch up that wound and heal the biological and anatomical threats to that person. But let's also bring in a psychiatrist. Let's bring in a social worker. Let's bring in outreach workers and people from the community who have been there, who know and understand what that experience was. And let's figure out what led to the precipitation of that event. Does that person have housing? Are they adequately employed? Are things okay at home? How is school going? And we bring in our outreach workers and our mentors to try to not only get that person and get that young person in particular back on track, but also reduce that really, initial first response to desire retribution, and say, let's take a step back. Let's heal not just what's happening anatomically, but let's heal the conditions of what's going on in your life, socially. 7 years later, what have we found? Our outreach workers, our doctors, our folks right here at Jacobi have reduced, for those people who were able to have access to this program, they reduced the reoccurrence, the readmission due to a violent injury between 50 and 60%. That is one of the most effective interventions we have at reducing the reoccurrence of violent crime, period. And so when we talk and when we have these concerns, when we have crises where violence starts to increase in our community, we know that one of the most effective things we can do is take a public health approach. And it is these heroes right behind us. It's our doctors. It's our leadership at Jacobi willing to take that risk who made that happen. So I want to give all of them a huge round of applause. Because this is significant. This is a breakthrough, not just in our community here in the Bronx, but this is a breakthrough for our country in how we create safety that is sustainable in our communities. And it's no surprise to us and to our advocates and to our community organizers that the way we create safety is investing in community and relationships to make sure that young people get on the right track. And so what's our job? I came in a couple of weeks ago to tour Jacobi Hospital, and we also toured Elmhurst Hospital as well, figure out how are things going since the pandemic, how are things happening in reopening. And this correlation with violent crime was a part of it. And this treatment plan for this is part of it. So our job, we came in and said, you know what, when we find something that is evidence-based, that works to improve people's lives, our job is to fund it. And so we're going to Washington. And our job is, and so I made sure that we called up Leader Schumer, that we're partnering with Representative Bowman, whose constituents also rely on Jacobi Hospital for their treatment, and saying we're not just we're going to ask for funding, federal funding and resources right here at home to Jacobi to expand this program so that it's not just healing our community, but that it is a light and example to head and spearhead the way for the entire country's approach to violence and violent crime. So I want to thank I want to thank Representative Bowman. I want to thank Leader Schumer. I want to thank just our champions and our heroes behind us. You're out here working with our youth, making sure that this is going. I want to thank our leadership for Jacobi for taking this risk 7 years ago before this was the conversation that it is today. I want to thank our doctors who are making sure that we're designing this program and also making sure that this is studied and submitted so that we see that it has clinical published results. So thank you all so much, and I'm so thrilled to to introduce our newest representative right here in the Bronx, Jamaal Bowman.
Thank you, Congresswoman Ocasio-Cortez. Thank you, Majority Leader Schumer. Thank you to the SUV program and those who represent that program. I have to tell you, I would not be a member of Congress if it weren't for programs like SUV. If I didn't have the mentorship, the coaching, the guidance, the friendship, as a young kid who used to run these streets like a lot of my former students, I would not be standing here today. And it's an innovative program, but it's also a very common sense program. Let's invest in the people who come from the communities. Let's give them the resources that they need, because guess what? They go where many of us don't want to go. They speak to the people that many of us shy away from. They know the neighborhoods. They come from the neighborhoods. They understand the context. And that's why we must be investing a lot more in them than we invest in other forms of violence prevention, which at that point is too late. This is about being proactive. This is about being preventative. This is about believing in our young people and the people that come from communities that have been historically redlined due to policy and policy decisions by elected officials. The violence that happens in certain areas of our city is not by accident. It's because of bad decisions that have been made historically. But in investment in programs like SUV, $400,000 is the starting point. We need to go much bigger than that, not just here, but nationally. Will help us to be preventative and proactive in stopping and curing violence. I want us, I come to this press conference and to this work from the perspective of a father, but also from the perspective of a former educator. And I want us to think about the trauma that our communities have gone through over the last year due to COVID, but the trauma that these communities have been going through for decades. And this is a response to that trauma in a proactive way. Many times our kids are just looking for someone to connect with, to engage with, to talk to, people who will listen to them, and people who will help create pathways for them out of their current circumstances. And SUV and SNUG and many other cure violence programs are exactly that. As we rethink and reimagine and redesign public safety, this is exactly what it looks like. The people behind us who have been doing the work, leading the work for years. And by the way, they were leading the work before they had any investment. They were doing it for free before all of us came to this room today. But now it's time to finally invest in them truly and properly. And this is how we deal with the issues of trauma in our communities. And this is how we begin to have real conversations around food security, housing security, job training programs. This is what we're here to do. We are here to respond and help them to continue to respond to all of the neglect that's been happening in our communities for decades. So thank you to all of the medical professionals at Jacobi. Thank you for your vision and for skipping right past us and going right to the community and bringing us in on the back end so that we can be as supportive as we can be. And I also want to just share a couple of quick anecdotes with you. So the school where I founded a community school about a half a mile from here, not too far from here. So unfortunately, if one of my students got hurt, we had to come to Jacobi. I had a student who once had such a bad accident that he ruptured his liver and had to come here. And I sat in the waiting room with him and his family for hours on hours, and Jacobi pretty much saved his life. I had another kid who was sliding down a banister once with his book bag on, and you know what happened when he had his book bag on. He fell backwards, head trauma. We brought him here. Jacobi saved his life. So, Jacobi, you've been doing great work for me on a personal level, for the community on a larger level, and I'm just excited to partner with my two colleagues to invest in SUV and SNUG and programs like that so we can bring transformative change to our community and save lives. Thank you all so much.